So this is a station on the cardiovascular station for the preparation of the MRCPCH exam. The screen that you have seen of a child is provided to the candidate, and we start with the discussion now.
Yeah, so that's time up.
Okay, so Harshada, you can enter the station.
One of the people.
Just speak a little loudly.
Hi, I'm Dr. Harshada. I'm one of the pediatric registrars. Can I please confirm this is Troy and you're his mom?
Yeah, I'm Troy's mom. Yeah.
We're going to examine Troy today. I'm going to have a look at his hands. I'm going to have a look at his. I'm going to listen to his chest, and I will talk to get him. Okay? Is that okay?
Yeah, that's fine. Yeah, go on.
So wash my hands and first have a look at the child. What does he look like? Does he look well and well, or does he have any support?
So he looks unwell.
Okay. Does he look pale or cyanosed?
Yeah, so he looks pale. Doesn't look cyanosed.
Any dysmorphic features?
He's got a bit of a, as you can see in the photo, a bit of a retrognathia or micrognathia.
Okay. And in terms of height
And low set ears.
low setness.
Yeah, triangular faces.
Does he look well grown or does he look small for his age?
So he's basically failing to thrive.
Okay. So, does he have any aids like oxygen or any monitors or hearing aids or any that
No hearing aids, no oxygen, no nothing attached to him.
okay.
Yeah.
Now
But he's
now
unwell, he's sad, and he's a bit of panting.
and he's sorry?
Panting.
Did you say panting?
Panting, yeah.
Okay. I'll have a look at his hands first. I'm looking for any pallor. I'm looking for any clubbing. I'm looking.
Okay, so there's no clubbing, but there is pallor.
Okay. I'm looking for any peripheral stigmata of infective endocarditis, like Janeway lesions, Osler's notes.
No stigmata of infective endocarditis.
Okay, and yeah, fine. I will also have a look at his pulses bilaterally. Look at the radial pulses bilaterally. Are they equal? And I like to look at their character.
What pulses you want to see? Bilateral? Radial, yeah, they're equal.
I'll also have a look at his. I would ideally like to look at the radial delay or radiofemoral delay, and also at his blood pressure later.
There is no radiofemoral delay. Femoral pulses are well felt.
I will also have a look at his hands to look for any dysmorphism in terms of any single palmar crease or thumb abnormalities or any other abnormalities on the fingers. Or
No hand deformities.
I will now go to the neck. I will look for any raised JVP, any scar sinuses.
Yeah, so he's only 10 months. There's no JVP.
Okay. Now I will have a look at his chest. I'm looking for any tachypnea, any signs of any dilated veins, scars, sinuses, any marks or surgical scars, and yeah.
So where do you want to look for surgical scars?
On the chest, medially or laterally.
So there is a lateral thoracotomy scar.
Okay. Which side is it?
Left.
Left side.
Yeah.
Fine. So I will be looking for any visible pulsations and or apex impulse.
No visible pulsations. Apical impulse. Where do you want to check?
I
How
will
are you
look.
gonna check?
Yeah, I will look for. I'm just inspecting as of now.
Yeah,
Yeah. I will now palpate and look for the apex beat. Where is the
yeah,
apex? I will look bilaterally.
yeah. So it's on the left.
In the left,
The
where is?
left mid-clavicular line, fourth intercostal space.
I will also look for any thrill or palpable here.
So there is a thrill in the pulmonary area, and there is a heave as well, parasternal heave.
In the left parasternal here.
Yeah, left parasternal heave.
And he's got the palpable. He's got a thrill in the pulmonary area. Okay.
Yeah,
Now, I will also auscultate it in all the four areas. Any in the mitral, tricuspid, aortic, and the pulmonary area. Hello.
yeah,
So that's
yeah.
6 minutes up, but yeah, you just continue for the last part.
Try. Have you oscillated everywhere?
Yeah.
Yeah, so you oscillated everywhere, and you found tricuspid area like a pan-systolic murmur. And in pulmonary area, you heard a loud ejection systolic murmur that radiates to the back.
I didn't get that. Tricuspid area, pansystolic murmur.
Yeah, sorry, tricuspid pan-systolic murmur, and pulmonary area, grade 2 ejection systolic. It is not radiating to anywhere. Pan-systolic murmur in tricuspid area, and a grade 2 systolic ejection systolic murmur in the pulmonary area.
In the pulmonary area.
Yeah.
And does it have any radiation? And I will also like to.
Yeah. So none of these, what do you say, are radiating anywhere.
Not radiating. And
No.
I will also do the maneuvers to look for any maneuver which increase the murmurs. Like sitting.
No. Okay. So you wanna
You will not get time to do maneuvers in exam.
Okay, fine. I'd like to complete my examination by
Yeah.
dating the VCT,
Yeah.
by palpating the liver and
Yeah.
also by looking to look for ED.
Yeah. So there is mild edema. There is liver palpable, and yeah, there is liver palpable. There is pedal edema, but there are no crackles. Dr. Safia, I've actually modified this case. Okay. So I'll continue.
I'm done now.
Okay, cool.
I do.
You've listened to the back, no crackles, liver is palpable, pedal edema is present. Okay, so do you want to summarize?
Pedal edema is present. Yeah.
Yeah,
So I've seen Troy is a 10-month-old boy who looks acutely and who looks unwell who's come with a history of failure to thrive. On
yeah,
examination, he has dysmorphic facies like triangular facies and low set ears and a micronapnia.
yeah.
He looks pale on examination and has his pulses are normal.
Pulse is normal. Okay,
Yeah, and he has left tracheotomy scar and
left. Yeah,
left tracheotomy scar with a normal apex beat in the left chill in the pulmonary area. Uh,
so yeah,
and uh, a transsystolic tumor in the uh, tricuspid area
hmm.
uh, with edema and palpable liver.
Fine.
So this looks like what syndrome is? I was thinking, just give me 2 minutes.
Okay, so just say this is so you think this is some kind of a syndrome?
It's a it's operated up.
No, this is
Just,
Harshada's
just,
time.
just wait for other candidates. Please wait for till 3 minutes before the management discussion ends, and then we can
Yeah.
give our inputs.
So you think this is some kind of a syndrome? So do you want to put together all these numbers and what do you think what's happening inside?
So this is
10
this
months old.
pulmonary stenosis.
Pulmonary stenosis with
With pansystolic murmur in the tricuspid area, you said.
time up. Okay, so how do you want to manage this?
Yeah, so you'll
So according to you, this is some kind of syndrome with the pulmonary stenosis. How do you want to manage now?
And the sorry, before
Yeah.
that, the examiner will ask you, do you think the child is in failure or not?
Right, so as we have heard, the candidate does a well-structured examination of the cardiovascular system, going from the general look of the patient at the looking for signs in the hands, face, neck, and then proceeding on towards the chest. And she also does a good job in picking up the various signs which are present in this particular child. Now, the next part of the station is the most key bit, which is piecing all of these signs together and then giving your giving your summary, putting forward a differential diagnosis, or if the diagnosis is quite obvious, you can put that right away, and then your management is discussed. So later part of the video, we go through what discussion we do and the kind of feedbacks where the candidate would have has the scope of improvising. We talk about the general cardiovascular system management.
Where will you manage? Where will you manage this child? If you've seen this child coming into A&E.
Okay, so you have to involve dietitian, man. This child is failing to thrive. Okay.
Okay. Got it.
Always remember, okay, if someone is failing to thrive, they can't put a major. No one can do a major cardiothoracic surgery. They're saying it is PDA. What I say, PDA
I think it's a
ligation.
BT. What it can be a BT shunt because it's a pulmonary stenosis, so we could want to increase the pulmonary flow. Maybe
Yeah.
a BT
So
shunt. Yeah.
okay, this was the previous diagnosis, Safia. Okay, so I
Yeah.
will tell you. I've modified this now. Okay, so this is basically
Any reason why he has a pulmonary stenosis or kind of
There is no pulmonary stenosis in this child. So I'll tell you about it. Okay.
room overload? You mean?
Is this an increased pulmonary flow, a dilated?
Yeah, you're coming to the right direction.
Findings that there is a dysmorphism. I don't know. Were you able to identify that there was a dysmorphism?
Yeah. We were looking for what
You've got this fish mouth appearance. You've got this hyperteliorism. You've got this low set ears. Identify the PSM, the ESM ejection systolic. ESM, and then and which site it is coming, and the heaves and all those extra cardiac signs. You need to pick that up, identify. There's a separate domain for picking these signs up and then correlating all of these things together.
Right, so that was in brief the highlights of the discussions that we had for this case. And if you look carefully in the video, you will find that we have given away the diagnosis and we have also highlighted the important dysmorphic features. However, in your actual exam, if you were to get a child with complex dysmorphism or a diagnosis which you do not know, do not get taken aback or surprised. It is the approach that matters, how you are able to pick up, identify, and reason the clinical signs. So if you'd like to find out more about this discussion, this video, leave us a message, join our WhatsApp and Telegram groups, and if you'd like to join and participate in these kind of discussions for preparing for your exam, more than happy to welcome you on board. Thank you.